could be set to reverse.
Those are the papers at 17 minutes past 7. It's the must-have accessory for up-and-coming Hollywood stars. A set of perfect teeth and a whiter-than-white smile. Like yours, really.
Or Julie's. Now, everyone wants one. Of course, do-it-yourself teeth whitening kits are on sale for as little as £10.
Hang on, though, there is a snag, because it seems some of the kits could damage your gums. The British Academy of Cosmetic Dentistry warns that users could end up with burns and ulcers.
Yes, our reporter Richard Westcott has tracked down one woman who has had problems.
There are two key warnings here. Number one is about kits that you might buy on the internet from abroad. They can have a much higher concentration of bleach in, sometimes 5 or 6%. The second warning, according to the Academy, is about normal kits that you would buy in any shop across the UK. They have a much lower concentration of bleach, by law just 0.1%. The problem is some of the gum shields you get with them a one-size-fits-all. That means it might not fit your mouth properly, the gel can go onto your gums, it can burn your gums, and that's what happened to Tammy here. Tammy, hi. Sorry to interrupt you in your work. How are you?
Fine.
Okay, can you tell us a bit about what happened to you?
I used a tooth whitening kit and it burnt the top of my gums over here. My teeth were okay, they were just a little bit sensitive, but it was mainly burning to the actual gum area, and it looked like ulcers on the top of my gums. It really meant that I couldn't eat certain foods, and hot drinks were incredibly painful, and it was also painful to brush my teeth.
And when you went to your dentist, what did he say to you?
He looked at my teeth and he looked at my gums. He was like, "What have you done to your gums?" So being in the beauty industry, I do know to follow instructions carefully and to be careful, so I did. I followed the instructions properly.
And you still burnt your gums?
And I just burnt my gums. I think it's because the accelerator actually goes onto your gum area and not onto your teeth, and that's what caused the burning.
I've spoken to some kit suppliers. They say thousands use them with no problems at all. It saves people lots of money, and if you're careful with the gel, follow the instructions, you'll be fine. Richard Westcott, BBC News.
Well, with us now is Dr. Uchenna Okoye, who's one of the UK's leading cosmetic dentists. Good morning. These things are getting very popular, these kits, aren't they?
They are, indeed. More and more people are finding that they're more accessible, and they're coming in asking for it. So I'm doing a lot of it.
And, of course, these packs they're available pretty much to everybody because they are so much cheaper than their traditional cost, which can be upwards of £500.
Absolutely. Which is a problem for us as dentists because, you know, there is a reason why they're cheaper. And the problem with them is that a lot of them are more acidic. So, in effect, what they do is dissolve the enamel of your teeth. So I've had patients that we've had to kind of, you know, cap every single tooth in their mouth because there's so much damage being done. It can also burn your gums and cause trauma.
Is that not just not following the instructions? Because I thought all of this was just based around the hydrogen peroxide gel.
Yes.
So
the products that you buy over the counter are much weaker. So what a lot of manufacturers do is they add acid in there, basically. So you can have the two extremes from where it doesn't work because there's not really anything in there that has the effect, to the other extreme where it's quite acidic and so it dissolves the enamel of your teeth.
Does anybody really need to get their teeth whitened?
Well, I'd say why not? Absolutely. It's you know, it makes you look younger, it builds confidence, it just makes you feel great. So you don't need to do it per se, but you know, the society we're in now, you know, if it makes you look good, feel better, then I'm all for it.
But then as more and more people then are going to perhaps succumb to that, from what you're saying, there's no legislation to stop this acid? If it's actually dissolving the enamel in people's teeth, that's pretty serious.
Yeah, absolutely crazy. It's one of the things that we as a profession are, you know, trying to get legislation for. BACD, which is, as you know, the British Academy of Cosmetic Dentists, you know, we're very working hard to try and deal with this issue, educating people about what's available. And really, the bottom line is, if you see your dentist, you know, it's effective, it's safe, it doesn't do any damage to your teeth at all. I generally say sort of tooth whitening, if it's done well, does no more damage than having a can of soda or a glass of fizzy water.
But you could also go to the hygienist twice a year. That would keep them white too, wouldn't it?
No, well, the hygienist helps remove any surface staining. So hygienist is great, not just for the, you know, cosmetic stuff, but from keeping your teeth healthy as well. But with all the things that we eat and drink, tea, coffee, you know, the teeth, the core colour does change, and the hygienist can't change that colour.
And if you can't afford to do that, you saying avoid these kits, or...?
Absolutely.
Really?
It's better to wait, save, see the dentist, and stay away from the kits.
Uchenna, thank you very much.